Hey guys, today Diane and I, since we were together on this rare occasion, thought we'd talk about Z41, or needs assistance with personal care. Now this code has been the subject of a lot of our conversations recently. We've gotten a lot of questions about it, so we thought we'd talk about what the code describes exactly and why we shouldn't be using this code to describe our skilled treatment. So while on the surface it might appear that the code would support the medical necessity of, say, occupational therapy services, when you really get down to it and review the tabular, you'll see that in reality it doesn't. So in fact, use of this code has resulted in numerous denials. But before we get into why this code is not appropriate to describe our skilled treatment, I think it's important that we talk about how we've come to this conclusion and then how you can determine if a code is something we should or should not be using. So Diane, what's that first step that someone should take before choosing a treatment diagnosis?
So the rule of thumb in choosing a treatment diagnosis is to always first start with the ICD-10 tabular index. Look up the code in the index, and once you find it, it's important to scroll up and take a look at the category of codes into which this particular code would fall. This provides vital information about what the code sets represent and will provide information about whether or not that code can stand alone or must be supported by any additional codes. The next step, of course, is to always check your LCD to determine if the code is listed and supported as medically necessary.
All right, but we know that most LCDs used to have this list of codes basically that would tell you which codes supported medical necessity, so that you can kind of go to and look. But we know now that many of those LCDs have removed those lists. So if a therapist's particular LCD doesn't have one of those lists, what do you suggest doing then?
So the LCDs, the MACs have changed the LCDs quite a lot over the past year or so. Some of the LCDs only list codes that are not medically necessary. Some of them list codes that are only associated with certain CPT codes. One that does come to mind as still listing codes that are considered medically necessary is Palmetto GBA's LCD. So we do recommend, even if you're not in a state that's covered by Palmetto LCD, that you may want to consult that LCD, because it is a pretty conservative LCD, so we are pretty confident that if the codes are listed in there, they are probably approved by most other MACs. So I think that's a good place to start. If anything, it's just a good guideline. It also offers, of course, additional information about documentation to support the use of that code. So I would recommend there's nothing prohibitive about consulting an LCD from a state that you're not practicing in. It is just, after all, a guideline. So I would certainly recommend doing that if your LCD doesn't provide actual ICD-10 treatment diagnosis codes.
Okay. All right, so let's get into Z41. So that need for personal assistance, or need assistance for personal care, I think is specifically what it's called.
Right.
All right, so why is this code not appropriate for us to use as a treatment diagnosis?
So the Z74 group of codes is described as care provider dependency. In other words, these patients are dependent on a provider to provide this care, and the provision of the care is what is being coded in that encounter. These codes describe the reason for an encounter. They do not describe treatment or procedures associated with a particular condition. Furthermore, the ICD-10 tabular provides that this code falls into a status category, meaning the status of the patient is being described. And in this case, care provider or caregiver dependent is the description. So long story short, this code and others in this category are actually used as an encounter with a patient. Think of a home health situation where an aide goes out to the home and provides personal care, bathing, grooming, whatever, for a patient. That would be covered by this code. They are providing personal care for the patient who is dependent on the caregiver for that care. It's not appropriate to support the need for occupational therapy or any biomechanical deficits which the patient presents that would require skilled intervention to improve or resolve.
So I know that there are a lot of Z codes. So are there any Z codes that might be appropriate for us to use?
Yes, there are some Z codes. Those that fall into the aftercare category can actually be used appropriately to describe the need for treatment for skilled therapy. The aftercare codes often do require some kind of other treatment diagnosis or medical diagnosis to back them up. They typically cannot stand alone. When we think of aftercare codes, we think a lot of the aftercare for fractures or the aftercare for hospitalization or something like that, but we must always provide the actual reason, so the actual fracture or the actual, medical condition that required hospitalization.
Okay, so guys, we know that the coding process can really be challenging sometimes, and codes like the one we just talked about today aren't always as cut and dry as they would seem given the description of the verbal or the written description of the code, the name of it. So if you take anything away from this video, we really hope that it's that you just question the codes that you're using. You go and do your due diligence and make sure that you understand the importance of doing this research and making sure that the codes you're using appropriately support and describe the treatment you're actually providing. Coding, much to our chagrin sometimes, is just as important as the skilled care we're delivering and the documentation that we're using to support that service, because after all, that is what we're submitting to Medicare and saying that we're doing for our residents. So while it might not always be easy, it's something we really have to do and we have to get better at. So hopefully you take that away from this.
That's right. Always consult the tabular and the LCD first. But if you have any questions, reach out to your RVP or, of course, one of us, and we'll be happy to work through any challenges you're having with coding.
All right. Thanks for watching, guys. Happy documenting.